Merriam-Webster Dictionary defines healthcare as efforts made to maintain or restore physical, mental, or emotional well-being, especially by trained or licensed professionals. But the personal definition can vary. The meaning of healthcare can differ around the world, and it's sometimes forgotten how integral it is in our lives. In the United States, we have the privilege of advanced healthcare, but that comes at the cost of high prices that some can't afford. There are also other countries like Kuwait, with universal healthcare included for all citizens. However, in other countries like Vietnam, there is virtually no healthcare provided. We often overlook the system, and many people are unaware of its prices or even their own insurance plans. Looking at our own students in Jackson High School, only around 1 in 10 people in this age group actually know what type of healthcare plan they have. Parents are often the provider and do not disclose the information to their children. This ignorance is not uncommon, and it puts into perspective how many people are unaware. Unlike some other countries, there's no universal healthcare offered in the U.S. Meet Jordan Salvatore, a med student from Ohio, here to give her perspective on the healthcare system in the United States.
So what is your big opinion on healthcare in the United States?
I think there is a ton of room for improvement. I feel that it's collapsing underneath us between the staff shortages, the cost of healthcare. It's just not a good place to be for anybody, especially because everybody needs healthcare.
Yeah.
So I definitely see some room for improvement. I'm sure a lot of people do.
And then, are there any instances or in your life or in someone you know's life where you've had to rely on the healthcare in the United States to save your life, or had any close calls or dangerous circumstances?
Not me personally, but my grandma, her health started declining over the last year, and I was really on my mom's back about, we got to find somewhere for her to live, like a nursing home, because she couldn't take care of herself anymore. You just kind of get to the point where you just can't do it anymore. You go senile, you start forgetting things. So that was a process because my mom started working full-time this year, and you had to call around and see which nursing homes took Medicare and Medicaid, because it's what my grandma has. That was a whole process in itself. It took forever. I think the whole process took. But I work at a nursing home, and it's private pay, and the people who live there pay anywhere from $5,000 to $10,000 a month to live there. Their families do, which nobody has that money unless you're a doctor or something, or you have a good career path. But the average person doesn't have that money, so that was pretty challenging. Luckily, we were able to find. At first, the first nursing home we put her in was horrible. They gave her the wrong medications. That's a different story in itself, so we had to get her out of there. She ended up going back to the hospital. She was in and out of the hospital 3 times, and then we finally found a place in North Canton, and she loves it there. Her and her roommate are besties, and they take good care of her there.
Can you talk more about the amount of money that you or your grandma has had to spend on healthcare?
That's the thing. She doesn't have money to spend on healthcare. So all these years she got her first pair of glasses this year, and she has not been able to see for the past 3 years because she's been wearing the same pair of contacts. Granted, she took care of them, but your eyes change over time, especially when you get old. They change at a more rapid pace. So she couldn't get glasses or contacts. She couldn't get dental work done. She could see a doctor when her insurance would allow it, but there's only so much you can do when you don't have money for that sort of thing. Mm-hmm. And like I said, that was a challenge when we were trying to find some place for her to live. It's exactly why it's so hard for people to get care when they're old, and people don't get care when they're old because it's just not affordable.
While the U.S. has high-quality healthcare, many lack access due to high prices and limited availability. Healthcare includes doctors, medication, and other services that may be provided. However, in some countries, the basic needs aren't even met. For example, Vietnam. He has lived in Vietnam for his entire life, and he is willing to tell us his perspective on the conditions of healthcare there. The conditions have not changed for years, and the faith in the system varies from what those from the United States may be accustomed to.
Bùi Quang Chí.
Ok.
Nên còn mình hỏi mấy này.
Ok, bây giờ cái câu hỏi là cái hỏi với Thiên nè.
So, con muốn nói trước and then
Okay.
so,
Okay.
what does healthcare mean to you?
Chăm sóc sức khỏe có ý nghĩa gì đối với bạn?
Chăm sóc sức khỏe có ý nghĩa đối với bạn. Để suy nghĩ coi. Hỏi mấy câu cũng khó đó chứ. Để đảm bảo cho sức khỏe.
Tới câu hỏi thứ hai.
Why do you view healthcare this way?
Tại sao bạn xem chăm sóc sức khỏe theo cách này?
Tại sao
bạn xem chăm sóc sức khỏe theo cách này?
Câu hỏi như nó dài dòng không thế?
Thì nó hơi dài dòng mà tôi không biết dịch cho chính xác nó là sao. What do you mean?
Chăm sóc sức khỏe theo cách này là do cái điều kiện hiện nay là cũng như là nói như là cái tại nó hỏi này cũng cái câu này nó dịch ra hơi khó hiểu.
Đúng rồi.
Thì chăm sóc sức khỏe thì là do cái nhu cầu điều kiện hiện nay là ai cũng vô khoa học tiến bộ, ai cũng phải khám định kỳ hay là để theo dõi sức khỏe mình cho tốt vậy thôi.
Ok.
Thì bây giờ mình viết ngắn lại cho nó, dịch ngắn lại cho nó thôi, như là chăm sóc sức khỏe là do cái điều kiện hiện nay là cái nhu cầu của mọi người là tốt do điều kiện y tế nó.
As you can see, Vietnam's lack of access to healthcare, along with low quality and high prices, leads to limited confidence in the system, with many avoiding it entirely. This is Donna, a 16-year-old from Kuwait, here to give us her perspective on healthcare in her country.
Hi, my name is Dana, and I'm gonna be talking about healthcare in Kuwait.
What does healthcare mean to you?
Healthcare to me means improving your health.
Why do you view healthcare this way?
I view healthcare this way because I believe my country has made it really easy for us to get healthcare, so I don't view it in a negative way. I think it's just a way for us to better ourselves when we're not feeling the best. So ask me and I can bring this up, but when I was in the States, it's like okay, my parents are well off, but I went in for a stomach ache and it was 10,000 the bill, and I was like, for a stomach ache?
Yeah.
I go into the hospital here in Kuwait and I ask for a Panadol and they just give it to me for free.
Wow.
It just.
Have you personally had any negative experiences with healthcare?
Not really. Every time I go, it's just a positive experience. And I'm about 16 years old and I have been going by myself to the clinics and hospitals since I was 12.
Wow.
It's
no
they're really
parent,
nice there.
no guardian.
Nope. I literally just go in and you give your civil ID and then he prints out this little paper thing that with your number code. Sorry, because I know the word in Arabic. I'm trying to think of it in English, but yeah, and then you just wait for your turn and then the doctor sees you and they're really nice about it. They get a lot of children anyways.
Do you typically have long waits to see doctors or long waits in the ER in Kuwait?
In the ER, no, it's like really, really fast. And ambulances are free here. So if there is an ER that is booked, they'll just take you to the nearest hospital. And we have like hospitals in every block.
Wow.
And as far as like actually just going to the clinic for a checkup, or just like if you have a headache, you go to the clinic. And then if it's really bad, the clinic refers you to the hospital. So the clinics, depending on the time of day, it can go up from like anywhere to like walking straight into the doctor's clinic, like her little office, or the most I've ever waited was an hour. But that was because it was like a really big rush time. Like everyone was getting sick. This was like in December of last year, like 2021. And I
Wow.
realized that we're 2023, so 2 years ago.
As you can see, healthcare in Kuwait is very different from what we are used to here in the US. Kuwait's system of healthcare leads to a very different perspective, where the stresses and economic hardships that come with acquiring healthcare in the US do not apply.
The disparities in quality of healthcare and overall cost between these countries show just how different healthcare is around the world. When looking at this graphic, you can see how quality and cost are not necessarily related.
Despite it not being evident to many, healthcare accessibility differs drastically around the world. While some countries are fortunate enough to provide free healthcare to all, in other third world countries, very few have access to minimal healthcare. The Office of Disease Prevention and Health Promotion explains that quality of healthcare not only impacts our doctors and hospital visits, but it directly impacts our quality of life. Simply knowing that you as well as your loved ones will be taken care of when sick is something that everyone deserves. However, the comfort that comes with free healthcare for all is only a reality for very few countries. In a perfect world, all nations would have equal quality and accessibility to healthcare. But unfortunately, we don't live in an ideal world. Universal healthcare for all nations will probably never happen in this lifetime. But there is hope. Hope that situations for those in third world countries will improve. Even if healthcare isn't free, perhaps it could be more widely available. Above all, people must become more aware and educated on the vast extremes of what healthcare really is for people. By doing this, society can spread awareness and help to create a new normal for healthcare accessibility. The first step to making this change starts with asking the question, what does healthcare mean to you?